Your heart valve is failing. Repair or replace. And yes, a cow valve is a real option. Every year, 25,000 Americans die from mitral valve disease, but most patients don't know the difference between mitral valve repair and mitral valve replacement. This medical animation uses Rayall Hospital data from the University of Chicago, Mount Sinai Hospital, and Indianapolis. No pain, just medicine. If you have a leaky mitral valve, the gold standard is mitral valve repair. Watch the animation. A robot makes a tiny incision between your ribs. The doctor installs a ring or a MitraClip to stop regurgitation. Recovery? Most patients leave the hospital in 2 days. Heart disease is fixed. This is cardiac surgery at its best. Sometimes repair is impossible, heavy calcification or rheumatic disease. Then you need mitral valve replacement. The animation shows 2 options: a mechanical valve that lasts forever but requires blood thinners, or a biological valve from a cow. Yes, cow tissue is safe, FDA approved, and doesn't need lifelong risk of bleeding. Operation time is 3 to 4 hours. Treatment success rate is over 95% in top US hospitals. If you also have a slow heart rhythm, a pacemaker may be added, smaller than a AAA battery, no pain, fast recovery. You just learned mitral valve repair, mitral valve replacement, MitraClip, robotic surgery, and cow valves. Heart disease doesn't have to kill you, but this video will disappear from your feed if you don't act now. Subscribe to this channel and hit the bell. We post new medical animations every week. Your heart will thank you.